Assalamu alaikum. Good afternoon, good morning, or good evening. Thank you so much for joining us from wherever you're joining us from different parts of the world. I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine, Qatar, and I welcome you to this Population Health and Wellbeing series. Again, as many of you know, the objectives of this series are to discuss contemporary and critical topics relevant to healthcare, to medicine, and population health. We examine evidence-based germane practices to public health and patient care, and also describe opportunities and challenges in the evolving face of healthcare and population health. Just some housekeeping. Your cameras and microphones have been turned off. Please use the question and answer feature to type questions and comments. You can also actually use the chat feature and just put your question or comment in. We are able to see that and we will be monitoring it. Questions will be addressed at the end of the session, and I will be moderating the session today. This is, of course, an accredited activity, and we are accredited both by ACCME and also by the Ministry of Public Health, Department of Healthcare Professions accreditation section here in Qatar. Just a little bit about evaluation and certificates. Post-activity evaluation will be available in your Cloud CME account by March the 20th. And again, healthcare practitioners which are licensed in Qatar, they will receive their credits once we receive your Qatar MOPH license number. You will receive an email notification from the team once the evaluation is available in your Cloud CME account, and certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So again, a very, very warm welcome to all of you. And I wish everybody Ramadan Kareem for those of you who are fasting. I would like to introduce our speaker today. It gives me great honor and pleasure to welcome our speaker, Dr. Shiva Poobalasingam. So Dr. Poobalasingam, he's going to talk to us about prescription for physician burnout. Dr. Shiva, he has worked as a lifestyle medicine expert consultant with the World Health Organization for the Lifestyle Medicine for Diabetes Remission Project. And this project has been implemented as a pilot with the Ministry of Health Malaysia, already in a healthcare facility in Negeri Sembilan in Malaysia. Dr. Shiva is the founder and president of the Malaysian Society of Lifestyle Medicine, and he's chair of the advisory board of the Lifestyle Medicine Global Alliance. He is also on the advisory board of the International Journal for Disease Reversal and Prevention, and he's a member of the C20 Working Group for Integrated Holistic Health. Dr. Shiva also sits on the US-based True Health Initiative Council, the Global Positive Health Institute's Advisory Council, and the National Coalition for Mental Wellness in Malaysia. He is a board-certified lifestyle medicine physician, and he's frequently invited to speak on topics related to lifestyle medicine. He has also conducted several workshops on lifestyle medicine for programs jointly organized by the United Nations Population Fund, the Malaysian Ministry of Health, and University Putra, Malaysia. He is CEO of Amrita Integrative and Lifestyle Medicine Center and Amrita Lifestyle Medicine Academy. He's a published author and has written books on a mind-body approach to wellness and on the importance of herbs and nutrition in healthy aging. Dr. Shiva, a very, very warm welcome to you, and thank you so much for doing this session for us today. Over to you.
Thank you, Dr. Sohaila. A very good morning, good afternoon, good evening, ladies and gentlemen. It is indeed a privilege to be on this platform with all of you. I would like to take this opportunity to thank Dr. Ravinder Mamtani, Dr. Sohaila Chima, and the team at Weill Cornell Medicine-Qatar for having me here. So, ladies and gentlemen, we are going to be speaking on prescription for physician burnout. Disclosure statement. I have no relevant financial or non-financial relationships to disclose and will not be discussing unlabeled or unapproved use of drugs or products. So the learning objectives for today's session, we are going to outline the determinants of physician well-being. We're going to describe stress, burnout, and stress resilience, discuss lifestyle medicine and self-care, and recognize the role of mindfulness in stress resilience and the role of mindfulness in managing and preventing burnout. Physician well-being. What do we mean by physician well-being? So physician well-being refers to the optimization of all factors that affect the biological, psychological, and social health of a physician and the prevention and treatment of acute or chronic diseases experienced by physicians, including occupational stress and burnout. Now, awareness of occupational distress among physicians is not new, neither is efforts to cultivate physician well-being, though in recent years it has increased and it was amplified by the COVID-19 pandemic, because the COVID-19 pandemic highlighted the importance of physician well-being and its relationship to the ability of physicians to serve their patients well and for healthcare organizations to achieve their mission. The COVID-19 pandemic also brought to the fore physician burnout, where pre-existing stresses that were already present in the healthcare system got accentuated. For example, poor work-life balance, inadequate social support, perfectionism, and more. Now, if we look at the determinants of physician well-being, right, we can broadly divide them into the social and economic environmental factors, physical environmental factors, and individual characteristic personalities and behavior patterns. Now, we are going to focus today on behavior characteristics of a person, of a physician, where you have a tangible control over what you can do to improve physician well-being, whereas the other factors we will not discuss much in today's session. So we can divide these behavior patterns into diet, physical activity, stress, restorative sleep, social connectivity, tobacco and alcohol abuse. And we'll spend most of our time talking about stress. So let's, Raji, can you help to launch the poll? And we can see whether we are all experiencing any physical symptoms of stress now. So you can select your answers. Are you stressed right now? Do you have a furrowed brow? Is your jaw clenched? Are your shoulders slouched? Are your toes curled under? Do you feel tight in your shoulder muscles, arms, legs, hands, or lower back? Okay, so if you have any of these symptoms, they are physical symptoms of stress manifesting in the body. And of course, the highest being tightness in the shoulder muscle, arms, legs, hands, and lower back at 59%. All right. And slouching of the shoulders after that at 29%. Okay. So these are some small screening that you can do on your own, and you can know for yourself whether you are experiencing, some physical symptoms of stress, because the body registers the physical symptoms of stress before the mind registers it. Okay. All right. So stress is the health epidemic of the 21st century, right? Now, the prevalence of stress, if we look at prevalence of stress, the American Psychological Association, according to their survey, 75% of adults reported experiencing moderate to high levels of stress. And in a study that was published by Minichi, prevalence of workplace stress was 68%. And health professionals who worked long hours, 50 hours or more per week, and in night shift were more likely to develop workplace stress. So how do we define stress? It's common, right? We always say, I feel stressed, right? So we know that stress is the pressures of life. So when I look at the definition of stress, I like to kind of break it up into two parts, and I will talk to you in a couple of seconds about why. So the first part, of course, is the pressures of life. But more importantly, the second part is what we are interested in, is how a person perceives, believes, reacts, and copes with these pressures. Because this is what we have control over. We can perceive a certain situation differently, or we can learn how to cope with these pressures. Whereas the pressures of life itself, well, we don't really have a control over that. Now, a person experiences stress when the emotional, physical, or environmental demands exceed the person's resources and ability to cope. Now, let's look at the stress response. Now, the amygdala is the brain's radar or the sensor for stress. So the amygdala picks up a stressful situation or anything that is that threatens the body, right? Now, this activates the neuroendocrine and the sympathetic pathways via the hypothalamus pituitary adrenal axis and the medullary adrenal sympathetic system, resulting in the production of the stress hormones, the cortisol, adrenaline, and noradrenaline. Now, at the same time, the parasympathetic nervous system is inhibited. So you keep this in mind that the parasympathetic nervous system is inhibited, and we will talk about this somewhere down, down the presentation. So these stress hormones lead to an increase in inflammatory cytokines that is then linked to accelerated aging, abdominal obesity, glucose intolerance, vascular complications, decrease in neurotransmitters such as serotonin, dopamine, GABA. It also leads to a disturbance in the gut microbiota, leading to gut dysbiosis and impairs the immunity. So stress accelerates aging and increases the risk of physical, mental, and emotional disorders. Now, there are many causes of stress, right? Now, let's look at the causes of stress that are peculiar to healthcare professionals. For example, heavy responsibilities, competition, perfectionism, heavy workloads, long hours with not enough sleep, shift work, demanding job. Now, this translates into poor quality of life, low life and work satisfaction, poor self-care, poor healthcare, poor health, increase in psychological problems, increase in anxiety, depression, and burnout. So what is burnout? What do we mean by burnout? The psychologist Freudenberger coined the term burnout to describe symptoms of emotional exhaustion that are caused by a person's occupation. So burnout indicates prolonged exposure to physical and psychological stress that are not managed that results in the deterioration of the emotional functioning of the individual and subsequently a difficulty in adapting to their professional commitments. Now, WHO characterizes burnout with the three symptoms, that is exhaustion, cynicism or depersonalization, and reduced performance at work. Burnout is now included in the ICD-11. Burnout is linked to many health issues such as hypertension, sleep disturbances, depression, substance abuse, and an increased risk of suicide. Not only that, burnout also ruins relationships in families, with friends, and with colleagues, and jeopardizes a person's career prospects. Now, the social psychologist, Christina Maslach, she built upon Freudenberger's work and developed a psychological assessment for burnout that consisted of the three dimensions. And this is called the Maslach Burnout Inventory. And this is the gold standard for measuring burnout. Probably at the end of the session, I will share the MBI, and anybody who's interested can download it. We'll share it in the chat. All right, let's just look at the prevalence of burnout, right? Now, in a published study that compared burnout and work-life satisfaction, that compared US physicians to the general population, and this survey was done over 7,000 physicians. They used the Maslach Burnout Inventory, and they found that 45% of the physicians reported at least one symptom of burnout. Now, physicians were at a higher risk of burnout compared to other workers in the general population, 37% versus 27%, and more likely to be dissatisfied with work-life balance, 40% as compared to 23%. And in another narrative review that looked at burnout among healthcare professionals, the authors found that half of the physicians and one-third of nurses experienced symptoms of burnout. And what they also found was that frontline physicians and female physicians were at a higher risk of burnout. Now, Schoenfeld explored the overlap between burnout and depression, whether they are two separate entities or are they one, and is burnout work-induced depression? So in their study, they found that burnout and depressive symptoms were strongly correlated, and risk factors such as stressful life events, job adversity, and workplace support also overlapped. Now, 86% of those identified as burned out met a criteria for a provisional diagnosis of depression. So there is a lot of discussion centered around the overlap of burnout and depression, and it is ongoing. Now, what about physician suicide as compared to the general population? So Calmo, in her publication called Physician Suicide, A Call to Action, noted that male doctors have suicide rates that are 40% higher than the general population, and female doctors have suicide rates that are 130% higher than the general population. Now, if you remember, we talked about the fact that female doctors have a higher risk of burnout, and they have also higher suicide rates as compared to the general population. So thus far, we talked about the impact of stress and burnout on the individual, on the physician. So what does stress and burnout do to the healthcare system? Of course, it hinders the well-being of the workforce and the healthcare system. And this is one of the factors that are contributing to the healthcare crisis that is being experienced worldwide. Now, what about patient care? There's increased incidence of medical errors, reduces the ability to empathize with patient, decreases ability to connect with patients, and fundamentally, a person who's stressed or burnt out is not able to provide appropriate care to the patient. So how do we improve a physician's well-being? Or how do we prevent or manage burnout? So basically, improving physician well-being will help us to prevent or manage burnout. And the fundamental, or rather the foundation of physician well-being will be physician self-care. Now, how does a physician go about this? All right, how does a physician manage themselves, do self-care and promote well-being? So lifestyle medicine is an emerging discipline in medicine that can provide a pathway for physicians to embrace self-care and promote their well-being. Lifestyle medicine is an evidence-based approach to prevent, manage, and reverse chronic disease by replacing unhealthy behavior patterns with positive behavior patterns. Now, the core components are a predominantly plant-based diet, physical activity, stress management, restorative sleep, social connectivity, and an avoidance of smoking and alcohol in moderation. Now, when we talk about unhealthy behavior patterns are not limited only to our patients. We as physicians too have unhealthy behavior patterns, and which we need to create awareness within ourselves so that we can make the appropriate modification. Now, the pillars of lifestyle medicine can provide the framework for physicians to engage with positive behavior patterns that are compatible with overall well-being, replacing these negative behavior patterns. And risk factors for burnout can be approached through the 6 pillars of lifestyle medicine. Now, very importantly, the interventions that we are talking about, the lifestyle medicine intervention, can be done at multiple levels. It can be done to decrease risk factors for burnout before the onset. It can be reduced at the source as a primary prevention. It can reduce the severity of burnout. It can also minimize the adverse consequences of burnout. So it is, the intervention can be done at different levels, right? So when we talk about managing stress and burnout, all right, so occupational stress is a key component in the development of burnout. Now, to manage stress, or to handle the kind of occupational stress a physician faces, it is very important to develop stress resiliency. So what is stress resiliency? Stress resiliency is the ability to cope with life's challenges and to adapt to adversity. Now, the beauty of stress resiliency is that the levels can change and a person can be trained to improve the resiliency. This helps us to maintain our well-being in difficult times because life is not static, it's dynamic, and life is like a pendulum, right? So the pendulum swings up and it swings down and swings up again. So when life throws us a curveball, right? Now, a resilient person is able to then cope with these challenges that he or she faces, and this helps to protect against stress and related disorders, including burnout and mental health disorders. All right, now coming back to our amygdala. So let's talk about the connection between the amygdala and the prefrontal cortex before we go on to talk again about stress resilience. So let's say, all right, I will give the term the army general to the amygdala. So the amygdala is like the army general, okay? And the president of our brain is our prefrontal cortex. So the job of the amygdala or the army general is to do surveillance and give appropriate feedback to the executive center where the president sits. And the president at the prefrontal cortex will then make the necessary decisions to reduce the stress response. Now, if two things happen, one is that the amygdala and the prefrontal cortex do not communicate effectively, or the prefrontal cortex doesn't respond in a timely manner, then what happens is that a coup takes place in the brain, all right? So imagine in a country, if a coup takes place, what happens? So there's helplessness, there's agitation, there's frustration, there's anger, irrational behavior. Now, that's what happens when the amygdala is in control of the brain and not the prefrontal cortex. So when we talk about stress resilience, it is the capacity to activate the left prefrontal cortex so that it acts in a timely manner and to calm the amygdala, so to reduce the activity on the amygdala. Now, the idea of stress resilience and its capacity to activate the left prefrontal cortex and calm the amygdala, a lot of work was done by Richard Davidson, a professor of psychology and psychiatry at the University of Wisconsin Medicine. Now, in a study that was published, all right, they looked at the structural changes in the brain when a person has burnout and when a person doesn't have burnout. So the burnout group had reduced connection between the amygdala and other areas of the brain, which reduces the ability to regulate emotions. The prefrontal cortex thins, right? So remember, the prefrontal cortex is where the executive center is. So thinning of the prefrontal cortex is not something that we want. And there's reduction in the volume of the prefrontal cortex. All right, let's do our next poll. Raji, please, could you launch the poll? So this is on mind matters, right? So I am mindful. My mind is full, or I'm mindful. I'm fully present in the moment at this lecture, or my mind is wandering from time to time from what I did earlier and what I'm going to do. So I'm mindful, 19%. I'm mindful is 14%. I'm fully present in the moment and my mind is wandering. Okay, it's almost equal. All right. So let's go on and we'll talk a little bit more about mindfulness, right? All right, so we talked about whether we want to be mindful. That is the image on your mindful with the double L. That means your mind is full. That's the image on your left. Okay, we want to be mindful, which is the image on the right, which is calm and it doesn't have much clutter, all right? So we want to declutter our mind, all right, and be mindful, which gives us peace, all right, and reduces the stress. So in order for us to declutter, how are we going to do that? All right, we need to reset the mind. So how will we reset our mind? By doing mindfulness. So what is mindfulness? Mindfulness, developed by Dr. John Kabat-Zinn, is a process of bringing a person's attention to the internal external experience that is occurring in the present moment. Now, it can be developed through various practices such as breathing techniques, meditation, yoga, and other forms of training. Now, mindfulness is actually the art of being in the present moment and being aware of the present moment and focusing on what's happening right now, not focusing on the future or the past. Because a lot of our stress comes from the unnecessary thoughts that run in our minds. Now, here, as we practice being more mindful, we are able to create a space between the stimulus and the response. There's always a space, but it is how big the space is. The bigger the space, we are able to respond appropriately. The shorter the space, then we are more or less reacting. Okay. Now, the problem with our mind is we have many monkeys in the mind, and the fundamental issue is that the monkeys don't listen to us, but we listen to the monkey. For example, if let's say I have something that's bothering me, and then I decide, no, I don't want to think about it. I just want to keep it aside. But the monkey will keep on, nibbling at me, and finally I will start engaging. All right. So when we do mindfulness techniques, all right, we are basically giving the mind something to do to help us reduce the amygdala activity. Okay. Now, when the mind is engaged with some other process that it is consciously active in, then it allows the amygdala to reduce its activity. Now, mindfulness is not just practicing mindfulness when you sit down and do it. It is living mindfully, which includes mindful listening. Many a time when someone is talking, we are so engaged in, or rather so absorbed in trying to formulate the answer that we want to give them. We are not actually listening to what they're saying. Or, many times this happens too, right? Somebody's talking, we also want to say something, so we are interjecting, right? That happens sometimes. And mindful eating, it is a very important component of managing chronic diseases, for example. So mindful eating is not, one is, of course, you are able to savor the taste, enjoy the flavors, look at the presentation, but also it allows you to understand the cues that your body is giving you when you should stop eating, what types of food that you should eat. Okay. So how does mindfulness help us manage our stress? So what mindfulness does is that it evokes the relaxation response. Now, the relaxation response is the body's natural counterbalance. So this is evoked because the parasympathetic nervous system that was inhibited is now activated. All right. So here the parasympathetic nervous system is switched on and the sympathetic nervous system is switched off. Now, this is supposed to happen naturally. So when we experience an acute stress response, so the sympathetic nervous system kicks in, the parasympathetic nervous system is switched off, and once the threat has passed, the reverse is supposed to occur. Now, what is happening in today's time is that we don't have the external threats. The threats are in our mind. And we have the sympathetic nervous system on an overdrive, and the parasympathetic nervous system is continuously switched off. So what happens then? We have the continuous drip, drip, drip of the cortisol, resulting in chronic stress. Okay. So once the relaxation response is evoked, you have a physical state of deep rest that changes the physical and emotional response to stress. Here, the relaxation response reverses the symptoms that are present when a person experiences stress response. So, for example, the breathing rate comes down, blood pressure comes down, heart rate comes down, and you have improve in your digestion, improve in creativity, improve in focus. Right? Now, various published studies indicate that mindfulness intervention help to decrease cortisol levels. Not only that, MRI imaging shows that mindfulness meditation promotes stronger connection between the prefrontal cortex and the amygdala. and that mindfulness meditation can reduce the amygdala activity. Now, in a published study that looked at mindfulness-based stress reduction on burnout scores, it was found that mindfulness-based stress reduction helped to improve burnout scores and mental well-being for a broad range of healthcare providers. Now, Laza did a lot of work on mindfulness and the brain, and it is very interesting because if someone asks you, how long of mindfulness do I need to do for me to see some changes? Well, he's shown that in 8 weeks, there are changes that can be seen. Increased activation of the left prefrontal cortex, that is the executive center, that's what we want. Increased gray matter in the hippocampus, increase in areas that are related to self-awareness, that is important for behavioral change, compassion and empathy, which are obviously very important for a healthcare professional, and reduced gray matter in the amygdala. So that will help to reduce activity in the amygdala. And this is a very interesting study published in the American Journal of Lifestyle Medicine. They looked at the practice of lifestyle medicine and burnout. And they found that 90% of those who practice lifestyle medicine found that it positively impacted their professional satisfaction. So job satisfaction is an important component when it comes to also managing your stress or burnout related to your work. And practicing more lifestyle medicine, 43% reduction in the odds of having a burnout. And the authors indicated that the reason for positive impact was meaningfulness and a sense of accomplishment, improve patient outcome and patient satisfaction, and improve personal quality of life. Okay, let's do our last poll. It's our lifestyle quiz. Raji, can you help to launch it, please? So is your diet a stressor or a stress buster? What are your favorite food when you're stressed? Do you connect with nature regularly? Do you do things that you enjoy weekly? Do you exercise regularly? And what's your sleep patterns like? My diet can be a stressor or a stress buster. So 17% agreed. Said yes. So favorite foods, at least 1/3 take something sweet, chips and coffee, which is normal when a person is stressed. Well, when you're stressed, you're not going to be eating a carrot and an apple, right? And 30% connect with nature regularly, which is good. And 25% also do things that you enjoy weekly. Exercise is about 1/3. And well, the best result was the sleep. That's good. So 36% sleep at least 6 to 8 hours nightly. All right. Okay, so now we've talked about stress and how we're going to deal with stress with mindfulness and how mindfulness works, and we've looked at the research. So we want to talk a little bit very quickly about the other factors that we talked about, like your diet, exercise, social connectivity, right? Diet can either accentuate the stress response or ameliorate the stress response, okay? And burnout was associated with an increase in fast food consumption, infrequent exercise, and an increased consumption of alcohol. And the SMILES trial, which is a randomized controlled trial of dietary improvements for adults with major depression, indicated an improvement in mental health status after a 12-week Mediterranean diet intervention, if I'm not mistaken, about 32% improvement, right? In another study that looked at healthy diet and burnout symptoms among Finnish municipal employees, they found that regular consumption of healthy food items was associated with a lower level of burnout symptoms. And the authors suggested that the reason could be that healthy diet is anti-inflammatory in nature. And because burnout and depression there's an overlap, and so the suggestion is that the anti-inflammatory diet helps to mitigate the low-grade inflammation that may play a role in the pathogenesis of this disease. And the other thing is that the gut-brain axis, right? So healthy diet with a lot of fiber, etc., right, feeds the good microbiota, which promotes a positive gut-brain axis. So what should we be eating, right? Eat complex carbohydrates, fruits and vegetables, and predominantly plant-based protein. Avoid refined carbohydrates, sugar, caffeine, saturated fats, and trans fats. All right. Now, any form of carbohydrates, whether they are simple or complex, help us to build serotonin, that's why we feel good when we've eaten something sweet, when we feel stressed. But the issue about eating simple carbohydrates is that, let's say we've had this donut and a coffee, all right? Now, so immediately after that, all right, we feel good. And about 2-3 hours later, the sugar will crash because the sugar in the system will crash because it's all been taken up into the cells. And the body then will produce cortisol to break down fat to produce glucose in the body. And at the same time, caffeine produces cortisol. So we are actually eating, let's say, something sweet and coffee because we're tired, we're exhausted, and we feel stressed. We want something to pick us up. But actually, what we are eating increases the stress hormones in the body, right? Whereas complex carbohydrates also produce serotonin, but it is produced and it lasts longer and slower, right? Now, some vitamins like the B vitamins, magnesium, vitamin C, omega-3 fatty acids, now these help to blunt the effects of cortisol. They support the adrenal gland. They control the production of magnesium. So if you look at the image of Popeye, Popeye eats a lot of spinach, leafy green vegetables. So you see, nothing ever gets the better of him. No stress gets the better of him. Maybe it's all the spinach that he's eating and the magnesium that's in the spinach. All right. So your happiness prescription for today, all right, eat 8 portions of fruits and vegetables, which should be multicolored. All right. Now, for example, fruits like watermelon and banana. Now they they give you dopamine. Dopamine, I call it the Mr. Motivation. And banana helps you to produce serotonin, so which is our Mr. Happiness. Okay. Now, now regular exercise will help us mitigate the impact of stress. All right. So the image there is the high jumper from Doha, Mutas Barshim, who was an Olympic champion and world champion in high jump. So regular physical activity, maybe 30 minutes, 5 times a week. All right. Something that should be done by everybody. And if it's done in nature, connecting with nature helps us to reduce stress. Reducing stress helps us to prevent or manage burnout. Now, if it is done outdoors and you're exposed to sunlight, then this helps us to produce vitamin D. So vitamin D helps us to improve our mental well-being, right? Now, sleep, other than the duration, 6 to 8 hours, timing of sleep is also important, right? And we need to be socially connected to people, not on social media only, but also in person, all right? Because excessive social media use has been linked to higher levels of anxiety. And doing things that we enjoy, for example, it could be singing, it could be swimming, it could be dancing, reading a book, right? On a weekly basis gives us some enjoyment, right? And obviously, avoid alcohol and tobacco, right? Now, this is a study that was done in Singapore looking at sleep quality and burnout. And the study found that poor sleep quality was linked to burnout. So this is important. Sleep is, and other than stress, the next component that very important is sleep, because in the healthcare industry or profession, right, sleep is, always something that is an issue. In many instances, people don't have enough sleep, right? Now, altruism. So what's altruism? Altruism is doing charity, doing something, for a higher purpose. So we say that altruism is exercise for the heart. So individuals who engage in more hours of volunteering have higher levels of well-being, all right? So this Ralph Waldo Emerson, who's an American poet, he has an interesting quote: happiness is a perfume which you cannot pour on someone without getting a few drops on yourself. Okay, so as we've come to the end of our session, all right, So in conclusion, my dear friends, burnout in physicians has reached epidemic proportions with mounting evidence indicating that a profusion of stresses are taking their toll on physician well-being. Lifestyle medicine plays a key role in promoting physician well-being and mitigating the impact of physician burnout. Moving forward, this will be essential to the success of the healthcare system. Now, health is a choice, not only for our patients, for us as well. So which is yours, right? We have to determine what is important to us and act accordingly. So before I end, I would like to wish all my Muslim friends here today, Ramadan Kareem and a happy Eid Mubarak in advance. Wishing everyone good health and happiness. Thank you. If you would like to have the website, it's here. Thank you.
Thank you, Dr. Shival, so much for that great presentation and for sharing your insights on physician burnout. So we have some questions coming in. So I'll just start with a few. So of course you already alluded to this, but I think since it's a question and maybe you can answer it again here for them. Do you think, physician burnout has an impact on patient safety and clinical decisions?
Yes, physician burnout definitely impacts physician safety. The incidence of medical errors will be higher when someone is having when someone suffers from burnout, and this impacts quality of care.
Right. Thank you so much, Dr. Shiva, for that. So, Dr. Shiva, I know you shared some of the published literature available, on some of the interventions like mindfulness and exercise and some of the which can help with resilience and help prevent or help, even just help with burnout. So, we have a question from another attendees on the practice of yoga. Um, and we know that yoga practice, it helps with the reduction of stress, hormones, cortisol, and then it basically helps with the reduction of stress and induces relaxation. Uh, did you find any published literature related to the practice of yoga and which can help with burnout specifically?
Yes, I think there are some published research, but I will need to look at it again. But there are many published research, definitely in terms of stress, but particularly with burnout. I will just need to look at that again. And if the person is interested, I could share it with the team here, and they can share it with you. Because
Right.
ultimately, mindfulness is a state, and it is
Yes.
achieved via the practice of yoga and other such
Right.
practices.
Right. Thank you very much. So, uh, Dr. Shiva, again, a question about, of course, we are talking about physician burnout. So, what role do you think organizations and employers can play in addressing physician burnout? I know you've spoken a lot about the lifestyle medicine aspects, but anything, on what maybe organizations and employers can do to help deal with or prevent physician burnout?
I think one of the things that if we look at it from the organizational perspective is that the long work hours. I think that is an area that, of course, it's challenging for countries worldwide and organizations, but that is one of the sort of the driving forces, the long work hours.
Hmm.
Yeah. And so if organizations can do appropriate, intervention. And the other one would be, I'm not sure how it is in Qatar, but let's say in Malaysia, like doctors are on call and then they work the next day. So post call, I mean, it's just not feasible for people to go on working for 36 hours at a stretch. I mean, so if you keep doing, so then that comes, the poor sleep comes into play, all right? So
Hmm.
basically looking at at the looking at the time or rather the kind of shift that doctors are expected to work, the number of hours, all right, that will be something that will be immediately like tangible.
Right. And we have a comment from one of our attendees about like also the role of culture and leadership styles, and how that can really help address maybe burnout in among physicians also.
Yes.
Dr. Shiva, anything on what can we do in medical education, and training programs to better to help, prepare future physicians or even physicians to handle stress? What are your thoughts about that, or any published literature available on that you may have come across?
All right. The published literature, actually, it's a very good question because I was thinking of talking about that, but then I thought my time would be,
Right.
there may not be time. But actually, there was one interesting study that showed that, at high school level, those who were going to go into medical schools, they were better off in terms of their mental well-being and their quality
Okay.
of life. But as soon as they got into medical school, then they sort of dropped and they actually became a group that had an increased risk for depression and other mental health disorders. And
Mhm.
burnout, there's increasing discussion about burnout that starts from medical school and then on to residency. So so this is in the publications, but I don't see, there's a lot of discussion centered around it, but I don't really see, people are maybe exploring a few things, but nothing concrete. But what I would think is that maybe from medical school itself, because, to get into medical school is competitive. Then to stay
Yes.
there, it is, the course is grueling. So I think introducing, like, for example, lifestyle medicine, or at least some stress management programs. One can be how they're going to manage time management, but it can also be how are you going to reduce this overactive amygdala? So tools to do that. Either you can do mindfulness or even simple breathing techniques. So they are taught this right from the time they enter medical school. It becomes a part of maybe a core curriculum that they learn. It can be physician self-care. So instead of
Right.
grappling with physician self-care after they have graduated and they are in the workforce, but we start this off to keep the physicians healthy.
Mhm. Sure. Right. So it's better if we try and address, even prevent it early on by giving them these kind of modalities that you've explained, how they can really help prevent, even reach that stage of burnout. What we can do in our lifestyles on a day-to-day basis.
Right.
What are your thoughts about burnout? For shift workers. So obviously, physicians also may be on call or night duty, especially emergency department. Any thoughts on how they can help prevent burnout? Because emergency medicine physicians again are probably at a higher risk for developing burnout.
Yes, that's true. And in fact, I think there are published studies that it's not just confined to medicine, but those who regularly do night shift have an increased risk of metabolic disorders. So I think that was Chandler and team did this research in London. So it is a little bit tricky or maybe a little bit tough. So what I can think of is that they incorporate, steps that will because you see, when you do night duty and you come back in the morning and you try to sleep, the sleep is not as effective or as good as you will get at night, and the timing of the sleep is also off. So one of the things is if the organizations can structure this night duty in a way that maybe you only do it, say, 2 nights a week. I mean, of course, these are just theories because it all depends on the workforce, the number of people they have in the workforce. But for the physicians themselves practicing these pillars of lifestyle medicine, and also doing some deep relaxation techniques, because there's some techniques like that. They have some small studies that show that 30 minutes of these deep relaxation technique is equivalent to like a 6 hour sleep, So maybe um, doing things like this may be useful for people who are in the emergency department.
So, Dr. Shiva, just the last question. I know we're coming to the end of the time also. So, of course, you mentioned, how we have the burnout inventory and how we can manage that, right? We have that tool to measure burnout. Are you aware of any tools to measure resilience or any point scale or anything by which we can measure resilience?
No, actually, unfortunately, we don't really have like a developed, I think, tool. I mean, as far as I'm aware,
Right,
that
right.
shows that improvement in measuring resilience. But it could, but I think it can be measured indirectly, but by levels of cortisol, etc. But not
Mhm.
like a, like a form that we can use.
Right. So, Dr. Shiva, any last thoughts, key points, summary takeaway from your session, which our healthcare practitioners and physicians who've joined us can take away?
Well, I think what I would like to say is that, as physicians, we need to also walk the talk. All right. So we then need to practice, or rather embrace a lifestyle that is, promotes our own well-being. Because
Right.
if we don't practice the parameters that promote well-being, then we can't impart that onto our patients. And it's important for us to be well as well. And yeah, I think that's what I would like to say.
Yeah.
Yeah.
Great. Thank you very much, Dr. Shiva. It's been a great session. We are really grateful for you taking the time out to do this session. So thank you very much.
Thank you, Dr. Shohaila. And thank you,
Yes.
everyone.
Yes. Thank you to everyone who is attending today, and we look forward to seeing you at our future sessions. So bye bye and have a good evening today.